Advantages, you learn the social context. You experience social support. You learn new behaviors. There's pure confrontation. You learn about group norms. Okay. I love group. I absolutely love group. It's always been my favorite way to teach people because I don't have to work so hard. In the beginning sessions, right, we're talking about, oh my gosh, everybody's looking at Dr. Pam, Dr. Pam, Dr. Pam, Dr. Pam. You guys remember your first college class? Okay, for many of you, it was yesterday. For me, I have to go way back, clear the cobwebs. As a college professor, this is what it looks like. The first semester, and I've got the students come in, and they don't know what to expect. They take their seats, and they're trying to figure out what to do. Everybody asks me the same question. We're going to the syllabus. Dr. Pam, Dr. Pam, Dr. Pam. The person beside them could have asked the exact same question, but they didn't even hear it because you're so in your own world. Forming, right? Now what happens after a couple of weeks in, we decide where we want to sit. We realize the smart girls in the front or the cute guys in the back, or I can plug my cell phone in over there. And what happens? You remember this? You came into class and someone's sitting in your seat. I was sitting there for the first 3 weeks of class, and now someone else is sitting there. Most of us remember that. Do you not remember that? So it really doesn't matter whether it's a official group or a informal group. Those are the rules. So now that I've been sitting in the seat, it's the storming as I'm jockeying for position. What happens on my end as a professor, I get to class and there's a wait. People are standing outside the class trying to get in because they're trying to get the seat they want. Was that any of you guys? Did you guys? Yes, you did. Yes, you did. Yes, come on. Don't act like you didn't. You wanted to sit beside so-and-so. You wanted to be in the front. You wanted to be in the back. So during those stages of group, that's when we are storming. Okay. I've already set the group rules, and then we're going to get to norming. So think about it. It's not necessarily only in a classical sit-down group session. This is how groups operate. Okay. So that question earlier we talked about psychotherapy was what type of group is it in? Guidance groups are for schools. Counseling groups don't mean you are the clear indicators you don't have a DSM diagnosis. Psychotherapy means that you do. Psychoeducational. What does that mean? Chanel, what's a psychoeducational group?
Like a group for, I don't know, like moms or teen moms, a group that provides education to those for more information on something.
What do you do, Chanel?
What do I do?
What's your current job?
I'm just the housing coordinator for now.
I'm just the housing coordinator. Please don't say that. What you do is so important to people, is it not?
Yes. Mm-hmm.
It is. It is. I'm a housing coordinator. I make a difference in people's lives. Mm-hmm. Don't you?
Yes.
Okay. So let's just change the verbiage. Okay. I'm a housing coordinator. I hear that you have other dreams and goals, but the people that you work with now, that's important. Okay. So in your current position, can you give a psychoeducational group on how to control your diabetes?
No.
Can I give a group on how to, what foods to eat to help you lose weight?
Yes. No, I don't think so.
What day in your program did you learn nutrition?
What was the question?
What day in your program did you learn nutrition?
We didn't learn nutrition.
So you can't teach it, okay? The goal of a psychoeducational group is it's in my wheelhouse. So I would bet, Chanel, that you can teach people how to balance a budget to maintain their housing.
Yes.
That's in your wheelhouse. That's a psychoeducational group. It has to be something that I know about that's in my world of expertise. Okay. I am never, ever, ever going to do a diabetic group and tell people to get out and exercise. Yeah, go out and run 3 miles today. When mama dies, what's going to happen? They're coming after me, right?
You're going to get sued.
Yes, I am. That's not in my wheelhouse. So remember, psychoeducational is about what I know. I can teach any aspect of the psychological, the social, the interactive part. But I didn't go to school, nutrition school. I didn't do that. Okay. Structured groups. Structured groups are what? Anybody. Somebody, my repeat offenders. What does that mean?
They have a certain theme.
Keep talking.
So structured groups are when you come in, you know exactly where you're going, what you're going to teach, and it's structured.
Okay. If I'm a structured group leader, I'm probably using a product as opposed to process. What does that mean? Anybody?
Product.
I would say first.
Go ahead. Like curriculum.
So if it's a product, it's go ahead.
I'm just gonna give like I'm just looking at the real world. I'm a mental health provider, so I now do adolescents. So say like all of my adolescents have general anxiety. I'm gonna use the ART book, in a lesson out of the book to be able to teach them about general anxiety or whatever the lesson is trying to teach.
Okay. So in a structured group, many times, good job, good answer. Thank you. Good answer. So my structured group are most often product groups. I have an authoritative leadership style. You're trying to get your kids back. You've got 12 sessions of DUI classes. You've got parenting classes, anger management classes. Very structured. There's no expectation of cohesiveness. Process groups, the healing happens in the process. The closer we get, the more we know each other, that's where the healing happens. However, in a structured group, that's not it. We don't have to get to know each other. You have to sit down and watch all those DUI videos, right? Watching people get car crashes and what it looks like. Because there's no assumption of the stages. We're not going through forming, storming, norming. We're not trying to get there. The assumption is I'm just teaching you something. Authoritative or a dictatorship, those are the groups where I've just got to teach you something. So when you see a question that says, what's the best type of leadership? It just depends on the group. It's that simple. What is the goal of the group? If the goal is to everyone needs to get their kids back, then I'm going to focus on that. So a process group is going through the stages. In a process group, the healing happens in the cohesiveness. The fact that I let my guard down and I trust somebody. Self-help groups, what does that mean? Give me an example.
Weight Watchers.
It depends on. Who said that?
AA.
Who said Weight Watchers?
I did.
Okay. Sergeant Major Rochelle.
Not Sergeant.
Okay. I'm sorry. How should I supposed to address you?
Just Rochelle is fine.
No. You got some letters and names in front of you. You own that. So,
I'm a chaplain.
Major Rochelle.
I just don't have my LPC yet.
Okay, hold on. We got to change that so I'm gonna put the right words in there. You earned your stuff.
Yeah, my work. That's my work. So, but
hold on. That's not your identity.
I'm sorry.
That's not your identity.
It is. So
one of the code of ethics talks about the when I don't identify myself as who I am, identify myself as my business.
Yeah.
Isn't that a defense mechanism?
It is. It is. It is. Look at that. Okay. I'm trying to rename you. Chaplain what?
Rochelle?
Okay.
There you go.
Okay. I lost my question because I only have one good brain
You were
cell working at this
asking,
point.
you were asking what did self-help? I said, like Weight Watchers, like weight control.
Okay, so
Maybe a
let's
type
go
of-
back. Let's go back. Let's go back. Just because I've been a lifetime member of Weight Watchers 17 times. Okay, so what does that mean?
You could come to this group for, like, say if you need weight control because your A1C is high, like for diabetes or something like that.
Okay, so what
Yeah.
I'm going to say is that if it's a Overeaters Anonymous, that's fine. That is definitely a self-help group because the person who's been the cleanest the longest, there's no professional in there.
Yes. Or it could be
Weight
a group.
Watchers, there's a professional.
Yes.
Weight Watchers is they've hired someone to give you accountability. So self-help group, and somebody said AA, AA, right? So
Yep.
AA is who's been cleanest the longest. Any of the 12 step groups, sexual, a sexual addict, a sexual addict. If I'm a gambler's addict, so all of those non-groups are self-help groups. But if there's an expert in the group, if there's a therapist, it's not a self-help group.
Yes.
Okay.
Dr.
Key
Pam,
groups. Go ahead.
so if there is a professional in it, what then would the group be?
Yeah, well, it depends on what we're doing. It could be a
Okay.
counseling group. It could be a psychoeducational group. It depends on what the goal of the group is.
Okay.
The goal is to understand self-help. Self-help are support systems to help with psychological stress. The groups are focused on issues such as weight loss and control. The groups are not led by a professional.
Okay.
Okay. That'll be the key in the question to know what it is. Okay. A T group is a training group. Before COVID happened, we used to have training groups all the time. I would take my students to the ropes course. Anybody had your ropes course? Your staff, yeah, right. It's learning, it's environmental learning, how we get here, how we support each other. That's a training group. A task group is a specific task. If you go to your boss this week and you say, hey, I think that we should really include, we should send out holiday greetings cards to all of our staff, all of our clients. Your boss is going to say, great idea. Go get a couple of peers and get it done. There's a specific task that has to be done. Okay. The goal in one of the questions, remembering counseling groups, you don't have to have a DSM diagnosis. Psychoeducational groups, I'm teaching you something in my wheelhouse. Psychotherapy groups are always going to be found in a hospital setting, a mental health setting, and then you most often have to have a DSM diagnosis. Okay. Okay. This is where we talk about content and process. So remember, in the process group, those are the stages for norming, forming, storming. In a product group, the goal is to get the piece of paper. That's the only goal, get the piece of paper. We're not tight in that group. I know none of you have ever been to anger management or DUI classes or parenting classes, but pretend you had a friend that did. The goal is not cohesiveness. The goal is not to get tight. The goal is to understand this is our job and we happen to make friends. It's okay. Okay. Let me show what that looks like in a question. My repeat offenders, do you see some things of maybe why you didn't get the questions right?
Yes.
Yes.
Yes, yes, I definitely do.
One second, just trying to pull up some questions here. Go back to the Howie book because that is really understanding the process. Okay. Okay. So group dynamics are how we operate. The healing happens in the stages. Content is what I teach. Process are stages. At the end of the day, if I have to get a sheet of paper, that's a behavioral technique. Okay. Group cohesion is the healing happens in the tightness. In some of the other books, you'll see lots of theories of the roles. Remember, no one chooses a role. You just kind of fall into that role. Can I have other many roles at the same time?
Yes.
I can. No one picked me with that role. I can be the facilitative. I can be the maintenance guy. I can be the blocking role. If it's the client blocking, is that a good thing? Why? Why not?
Because it's interfering with the group process or interfering with like the training or the session, not session.
Yes, absolutely. If the client does it, that's resistance. If I do it, it's okay. So, and not in this group today, but I've had many times, I have 35 people in this group. And many times what's happened is I've had someone who just doesn't want to shut up. And I have to say, anybody other than I pick on anybody other than Letitia can answer. So if that clinician does it, blocking is a good thing because I need the group to go on. I need to make sure everybody has input and everybody's seen as equal. Okay. If the client does it, it's a problem. The leadership styles are very similar to those parental leadership styles. Authoritarian is definitely appropriate in some cases. If you have been ordered to group and I'm trying to teach you 12 weeks of anger management, I'm going to be authoritarian. I'm going to tell you exactly what to do and how to do it. Authoritative is a good thing with families. Authoritative is everybody has an equal answer. Laissez-faire, what's that?
It's when the group can lead itself and the leader can take a back seat.
It says they're fairly lazy. What does that mean?
It may mean that like maybe a person doesn't want to kind of come out. They let all the other people do the work and they kind of loaf off or be on the phone or something like that, or kind of just,
I'm a leader though. I'm the leader. Laissez-faire leadership looks like what? I'm not going to be on the phone as a leader, am I?
It looks more relaxed.
Oh,
When
like
can I use it?
When your participants are familiar with your process as a leader.
They follow the rules. They follow the rules. Okay. In a group setting, we've gone from forming, storming, norming. I don't have to be there next week because the norms and the rules are already set. The group will happen whether I'm here or not. Okay. So laissez-faire leadership is I trust the group members will do what they're supposed to do. In an office setting, if you have a laissez-faire leader, they don't have to be on your back 24/7 because they trust that you're going to do what you're supposed to do. Okay. So laissez-faire leaders aren't lazy. They just trust the fact that my group members are going to follow the rules. Okay.